The decision to try for a baby is a huge milestone in one's life. So, here we will discuss the list of things to be done to prepare for conception. First, eat a healthy balanced diet. Enjoy whole foods over any processed foods. Also incorporate more organic fruit and vegetables into the diet to limit the exposure to toxins. Next thing is exercise. Aim to get at least 30 minutes of moderate activity for about total of 150 minutes each week. Start a multivitamin. Pregnancy is taxing on body's nutritional stores. So, give yourself a boost by taking a multivitamin to bridge any deficiencies as per doctor's advice. Folic acid has to be taken as a supplement to prevent neural tube defects during early pregnancy. Also, keep up with early physicals to catch health problems before they become severe. Do some blood work to check for cholesterol, thyroid, and blood sugar levels. If the BMI falls into the overweight or obese category, talk to the doctor about health strategies for losing weight. If the BMI is in the underweight category, also do the necessary measures to bring it to the optimum. Optimize blood pressure, optimize blood sugar levels because they are very important for a healthy pregnancy. Check for vaccinations. During the physical appointment, look for vaccinations which have been lapsed like tetanus or rubella because vaccinations can keep both the mother and the baby healthy and protected. Schedule a preconceptual visit and in that visit, look into the number of factors like age, previous fertility issues, or any medical problems that you might have to have a discussion with your obstetrician. Stop birth control. If you want to conceive, you have to discontinue any form of birth control. Many women get their first period within 2 weeks of getting pills. When the periods start, so does the first cycle of trying to conceive. Some women may get pregnant right away, but for others, it may take a few months. Track the menstrual cycle. Whether you have been on a birth control or not, now is the time to get into track with the menstrual cycle. Narrowing down the window of when you are most fertile will help to get pregnant faster. Also, an understanding of the menstrual cycle will help to know if there is anything which needs addressing like spotting or irregular length of menstrual cycle. The average cycle length is about 28 days, but it can range from 21 to 35 days and still fall in the normal healthy range. There are so many apps out there which will help to track the cycle. Determine the period of ovulation. It can be scientifically determined by using a follicular study using an ultrasonogram or by using many ovulation kits which are available. Limit toxin exposure. High amounts of toxin exposure can be dangerous for a developing baby. So, to lower the exposure, avoid synthetic fragrances, going bisphenol free, and choosing chemical free home and personal care products, and skipping certain beauty services which require chemicals. Eat more of the organic food. Practice stress relief. Taking a relaxing walk, practicing deep breathing exercise, or doing anything which can bring joy to the mother can be done. Try yoga. Yoga has a number of benefits for fertility. Taking on a regular yoga practice may help with emotions and anxiety related to conception process. Also, the body may stretch and strengthen in preparation for pregnancy. Visit the dentist. It is best to have the teeth looked at because during pregnancy the hormones in the body may affect the gums and teeth. Good brushing habits before pregnancy can help ward off pregnancy gingivitis and cavities. Quit tobacco, quit alcohol because fetal alcohol syndrome may develop and affect the baby. Quit drugs. Smoking using drugs can harm the baby in a number of ways. Smoking exposes the baby to harmful chemicals, restricts blood flow to the baby, and even may cause preterm labor. Drinking puts the baby at risk of fetal alcohol syndrome. Using drugs, heroin, cocaine, marijuana is not only illegal but may cause birth defects, miscarriage, or stillbirth, and have frequent protected intercourse throughout the cycle. Gather family history to know that if there are some genetic factors which have roots in the family tree and which may possibly affect the baby. Discuss prescriptions with the doctor because some may not be safe during pregnancy. Get good sleep. Limit caffeine intake. Daily intake recommendation for pregnant women are only about 12 ounces of coffee per day. So try slow weaning it off if currently consuming more than this. Drink water. 60% of the body is made of water, so keep yourself hydrated. Learn how conception works. To start, know how the fertility eggs travel down the fallopian tubes and need to implant in the uterus for the pregnancy to stick. And about 30% of the infertility cases can be traced to male factors. Make sure he schedules a physical, eats well, exercises, stops smoking and taking other drugs, and limits alcohol. Give your immune system extra help by eating a healthy diet rich in antioxidants, vitamin C, and resting. Please subscribe.